What's different between chronic migraine and new daily persistent headache is the way in which the chronicity or the persistence of the headache begins. With new daily persistent headache, it's a day, it's a time, it's a moment from which the patient never returns. With chronic migraine, as you may know, generally what happens is that there's a progressive increase in the frequency and severity of headache over time.
Every single day. That's what people with new daily persistent headache report. And maybe that's your situation too. If so, you're in the right place. New daily persistent headache is a primary headache disorder that's one of the most difficult to manage. World-renowned headache specialist Dr. David Dodick will help demystify what new daily persistent headache is, discuss the diagnosis and treatment landscape, and shed light on what is on the horizon in terms of research. Among many other distinctions, Dr. Dodick is the chairman of the American Migraine Foundation, past president of the International Headache Society, and director of the Headache Program and Sports Neurology and Concussion Program at the Mayo Clinic. He has authored 10 books and almost 400 peer-reviewed publications. Dr. Dodick, welcome back to the Migraine World Summit.
Carl, thank you for inviting me back. It's a pleasure to be here as always. And I apologize for the mask, but I'm afraid it's a sign of the times, isn't it?
Absolutely. And we understand that it's compulsory for you to wear it, and we appreciate you following the guidelines and supporting the cause here. So persistent headaches are some of the cruelest in terms of they never end and there's no breaks. Can you help us understand the basics of what new daily persistent headache is?
Well, Carl, as you said, persistent headaches represent one of the most cruelest forms of headache disorders. And there are lots of different headache disorders that may be persistent. And by persistent, it's another word for really continuous, where patients really never get a break from the pain. New daily persistent headache is exactly what it says it is. It's new, it's something the patient hasn't had before. It's daily, it occurs on a daily basis, and it's persistent or continuous. But what distinguishes it from other chronic and persistent headache disorders is the way in which it begins. So new daily persistent headache is a headache that's clearly remembered. In other words, patients can often remember the day, the time, and precisely what they were doing when it began. And that's unlike most other chronic persistent headache disorders, where there's often a crescendo or a buildup over time, if you will. It's unremitting from its onset, or at least within the first 24 hours, and patients usually never get a waking moment free from that pain from that point onward. By definition, it's persistent only if it continues for 3 months. So if someone had a headache that they clearly remember what they were doing when it began, but it doesn't last 3 months, then it doesn't meet the definition of new daily persistent headache. So in a nutshell, new daily persistent headache is a new headache that's clearly remembered by the patient, what they were doing when it began. It's continuous without any breaks in the pain, and it lasts for at least 3 months.
One of the most confusing things is how new daily persistent headache differs from chronic daily migraine. Our viewer Courtney has this very question. Can you explain how these two headache types are different, and how most people can determine whether they have one or the other?
Well, it's an excellent question. And it can be very confusing, not just for patients, but also for physicians and even for headache specialists. Because it looks like chronic migraine, the two can be almost indistinguishable from both a headache standpoint and an associated symptom standpoint. And by that, I mean the presence of nausea, sensitivity to light and sound, and so on. What's different between chronic migraine and new daily persistent headache is the way in which the chronicity or the persistence of the headache begins. With new daily persistent headache, it's a day, it's a time, it's a moment from which the patient never returns. With chronic migraine, as you may know, generally what happens is that there's a progressive increase in the frequency and severity of headache over time, such that a patient may go from having 4 migraine attacks per year to 4 migraine attacks per month to 4 migraine attacks per week, and then eventually they have persistent headache. That's not always the case, but invariably that is the case. And that's one way to distinguish chronic migraine from new daily persistent headache. It's all about the onset and the way in which it began, very suddenly versus progressively and gradually over time.
So it sounds like they share a lot of the same symptoms, and the key in diagnosis is the onset.
Correct. Yes.
What pre-existing conditions do you have to rule out before you know it's new daily persistent headache?
Well, the way I approach this, Carl, is I look at new daily persistent headache not as a single entity. I look at it in much the same way we look at headache disorders in general. Is it primary or is it secondary? Now, according to the International Headache Society, currently, new daily persistent headache is listed as a primary headache disorder. And I believe in some circumstances it can be primary, but there are circumstances where it can be secondary. And by secondary, I mean two things. First, it can be secondary or a consequence of some underlying illness. In other words, it's frequently been seen after an infection, for example. So the fact that someone has an infection, whether it's a systemic infection or whether it's a meningitis, some sort of infection leads to an inflammatory and possibly even an autoimmune response. And the patient, as a consequence of that infection, can develop what appears to be new daily persistent headache. That is different than the patient who happens to be in a museum, for example, looking at a painting, develops a headache and it never goes away. So I consider the patient who's had an infection or some other underlying illness from which they develop persistent headache to have a secondary form of new daily persistent headache. The other type of secondary new daily persistent headache is when it's not new daily persistent headache at all. There's an underlying disease that's causing what looks like new daily persistent headache. So you can think of that as a mimic. And so certain mimics, such as intracranial pressure or pressure inside the head that's too low, or pressure inside the head that's too high, or perhaps a blood clot in a vein. There are many different types of conditions that can give rise to persistent headache that may begin at a point in time on a particular day, but it's not new daily persistent headache. Really, new daily persistent headache is a diagnosis of exclusion. And by that, I mean all other causes need to be excluded. So usually that requires blood tests. It usually requires some imaging studies of the brain, typically an MRI scan of the brain, and often an MRI scan of the veins and the arteries, so-called MRV and an MRA, sometimes a spinal fluid examination, and sometimes there are other diagnostic tests as well. So new daily persistent headache mandates and requires a very thorough diagnostic evaluation to exclude other potential secondary causes.
It sounds like those tests are something that you're probably not going to get at your local family doctor. You may need to see a neurologist or even a headache specialist for.
Absolutely, Carl. So I think new daily persistent headache, because it really is a diagnosis of exclusion, requires someone with a lot of expertise in the evaluation and management of patients with headache disorders. So certainly a neurologist and even more so, a headache specialist who day in, day out evaluate patients with chronic headache conditions and knows how to approach and has experience approaching the phenomena or the condition of new daily persistent headache. So this is one diagnosis that really requires a high level of expertise to get to the bottom of.
Who does new daily persistent headache typically target? Is there an age or a particular demographic of people that this disorder affects more so than others?
Well, if you look in the literature, Carl, new daily persistent headache can affect children as young as 5, 6, 7 years of age, all the way up to people in their 7th decade of life. But typically, we seem to see what is something referred to as a bimodal distribution. In other words, there tend to be two peaks. A peak during childhood and adolescence, unfortunately, where kids around an average age of about 14 or 15 can develop new daily persistent headache. And then there's, in adults, it often begins around the ages of 32 to 35, maybe affecting women slightly more than men, although it's controversial as to whether or not that is the case. I must say, in my clinical experience, in my clinical practice, it's been kind of a 50-50 split, maybe a little more commonly in women than men.
Does new daily persistent headache overlap with chronic daily migraine? Do they run together, or can one person have both conditions?
Well, that's a good question. So technically speaking, an individual can't have both according to the International Headache Society. So if you have a patient in front of you and you think the patient may have new daily persistent headache, but the headache itself, the features of the headache and the associated symptoms look very much like chronic migraine. And let's say this is a patient who really can't quite clearly remember the onset, as is typical, and you're having a difficult time deciding. Then in that particular case, new daily persistent headache trumps or supersedes chronic migraine. So you render a diagnosis of new daily persistent headache in those cases. Now, I will say one thing. There is no evidence base for the treatment of new daily persistent headache. And what I mean by that is there have been no placebo-controlled studies that has ever shown any treatment to be effective for new daily persistent headache. So when we see a patient with new daily persistent headache and chronic migraine, and you really cannot, or it's very difficult to distinguish between the two, it makes sense because to make a diagnosis of chronic migraine, because many of the treatments that we're going to want to utilize in that patient are treatments that we would conventionally or typically use for chronic migraine. So that's just an important nuance that doctors and patients just need to be aware of.
Another question from our community is actually about that relationship between new daily persistent headache and hemicrania continua. And speaking of diagnoses, the difficulty of diagnosis, can you help us understand what hemicrania continua is and how you distinguish it from new daily persistent headache? Sure.
So hemicrania continua, again, is exactly what it says it is. It's hemi, it's one side of the head. Crania, the head. Continua, it's a continuous one-sided headache. Typically, as in contrast to migraine, hemicrania continua tends to be side-locked. So it's only ever on one side of the head. It doesn't become bilateral on both sides, and it doesn't shift from side to side. Hemicrania continua is also associated with symptoms that we call cranial autonomic features. In other words, patients can develop, particularly during intense periods of pain, tearing or redness of the eye, or drooping of the eyelid, or swelling around the eye, congestion of the nose, tearing from the nose, or a runny nose. Those are typical cranial autonomic features that are often associated with hemicrania continua. At least the patients I've seen with new daily persistent headache, more often than not, they're never strictly side-locked or on one side of the head. If they ever are unilateral, they tend to shift sides, but more often than not, the headache is diffuse, it's bilateral. So to be honest with you, I can't even think in my mind's eye of a patient who's had new daily persistent headache where the pain has been side-locked on one side. So this isn't nearly as difficult a distinction to make as it is between new daily persistent headache and chronic migraine.
So moving now from diagnosis to treatments, if new daily persistent headache is a distinct type of headache separate to migraine, why are migraine-specific treatments used?
Well, we don't know what the pathophysiology is, Carl. So we don't know really what the underlying biology is, what's happening in the brain and in nerves around the brain in patients with new daily persistent headache. But because the symptoms, the features of the headache itself, throbbing, pulsating headache, and the associated symptoms of nausea, sensitivity to light, sound, sensitivity of the scalp are very similar, then we would typically utilize migraine treatments or treatments that have been developed for migraine. The same thing too, Carl. I happen to do concussion, as you mentioned, and directed a concussion program. And people with headache after concussion often, and most often, they look like they have migraine, or they look like they have chronic migraine. And there are no treatments for post-traumatic headache. Yet we still utilize the treatments that are developed and approved for migraine, because to be perfectly honest with you, we don't have drugs or therapies that have been specifically developed for new daily persistent headache or post-traumatic headache. And finally, I'll say the one thing that treatments that have been developed to treat migraine do is they block transmission along the peripheral trigeminal nerve or central trigeminal pathways. And whether you have migraine or whether you have some other headache disorder, at the end of the day, the final common pathway is conduction of electrical and signals, other signals, chemical signals along the trigeminal nerve, both outside the brain and inside the brain. So if you can block that transmission, regardless of what started it, you can have a therapeutic effect. So using treatments that have been developed for migraine can still have an effect on other headache disorders, because they kind of use the same final common pathway, if that makes sense.
Yeah, and that adds a lot of clarity, actually. So thank you for sharing that. Do we see the same kind of success in the way that migraines managed with these treatments and prevention and improving things by 50% or more? Does that translate across when we use these treatments for new daily persistent headache? Do we get the same success?
Yeah, unfortunately, no. Whether you've had your persistent headache begin spontaneously, as is the case in new daily persistent headache, after an infection, which is kind of a secondary new daily persistent headache, after a torn artery or a ruptured aneurysm or concussion, typically migraine drugs, both acute and preventive, tend not to work as well as they do in people with, migraine or chronic migraine. But we understand the biology of migraine and chronic migraine much better than we understand the biology of some of these other headache disorders.
Tanya from our community wanted to know whether the CGRPs are helpful in treating new daily persistent headache.
Yeah, another good question. And it goes back to what I was saying earlier, Carl. CGRP, or calcitonin gene-related peptide, is a neuropeptide that is involved in propagating or transmitting signals along the peripheral trigeminal nerve. And the trigeminal nerve, of course, is the nerve that supplies all of the pain-sensitive structures inside the head and is very integral in the pathophysiology of migraine. So imagine, if you will, a protein that helps to transmit those signals along the peripheral trigeminal nerve. We block that in people with migraine, and it leads to either the migraine pain stopping, or when we use it preventively, we can prevent migraine attacks from developing. Going back to what I said about maybe it doesn't matter what started the problem. If we can stop the propagation of signaling in the trigeminal nerve, even in patients with new daily persistent headache, maybe that will be effective to some extent. We don't have enough experience yet. I do think CGRP monoclonal antibodies, as well as botulinum toxin, can, however, dampen the intensity of the pain. In other words, if we can drop someone's pain intensity by 50%, even without getting them pain-free periods, that to these patients is meaningful. The only cure that I've seen with these patients is usually time. And so with time, some of these patients actually go into a relapsing remitting pattern where they may have, and I saw a patient about 3 weeks ago with this, where she might have pain-free periods lasting months, followed by continuous persistent headache for months. And so she goes into this relapsing remitting pattern. And I think that tends to bode well, I think, for her to have more prolonged pain-free intervals over time. And then some people, for reasons that are not clear, of course, can go into remission. And so certainly that's been described. The predictors for remission are unclear, but certainly some patients do remit over time. And that's a reason for patients certainly to be hopeful. I'll also say, Carl, that the same approach we use in the management of complex chronic migraine that includes dietary modification, exercise, mindfulness, biofeedback assisted relaxation therapy, cognitive behavioral therapy, and pharmacologic therapies should be brought to bear on patients with new daily persistent headaches. So when you have a multimodal approach like that, rather than just drug therapy, that can make a substantial and meaningful impact on a patient. So I employ, and many of my colleagues employ, the same sort of multimodal approach, utilizing different therapies, even device neuromodulation therapies.
There's not a lot of research going on in new daily persistent headache, but there are a couple. And there's one that's an imaging study, another that's an immune study, a genetic study, a stress receptor study, and a brain study. Can you speak to any of these that you might be aware of, including the study sponsored by the American Migraine Foundation on headache genetics, which includes patients who have new daily persistent headache?
Yeah, so, the American Migraine Foundation started the American Registry for Migraine Research, or ARMR. They also initiated the International Study for Migraine Research, or IRMR. If a patient walked into a clinic in Sydney, Australia, or Scottsdale, Arizona, if we were collecting the same clinical information on that patient, on those patients, and we were housing that in a data repository or in a registry, and we were to collect a blood sample from that patient, and we were to upload and house all of the imaging studies, like MRI scans, for example, that person had, you can imagine that you would have maybe 50 patients with new daily persistent headache in our clinic over a period of decades. But if we were including all of these headache clinics, we would have 5,000 or 50,000 patients with new daily persistent headache. Can you imagine what we could learn about new daily persistent headache if we had 50,000 patients as opposed to 50 patients? That's really the reason that we began this registry at the American Migraine Foundation. And not surprisingly, we call it the American Registry for Migraine Research, but where these centers involved include headache centers that see all sorts of patients, including patients with new daily persistent headache. So we are capturing patients with new daily persistent headache across multiple centers, and we collect a blood specimen on each of these patients. And so that allows us and geneticists from around the world. We are now working with geneticists in the UK, in Australia, looking at the genetics of a variety of different headache disorders, hopefully including new daily persistent headache one day soon, and having a large sample of patients where we have the DNA, de-identified patients, by the way. These are, their identity is protected, but we know everything about the clinical characteristics of these patients. And we have DNA and we have imaging, and it's big data like that, and the ability to analyze now big data in a very detailed way that I think is going to get us to the fundamental questions that need answering for not only new daily persistent headache, but for all headache disorders. And then there's another study where the National Institutes of Health has a biobank, a biorepository at Harvard. It's the largest brain tissue repository in the world, where brains are received for certain disorders and diseases into this biobank. And new daily persistent headache was added as one of them. So you can imagine, again, when you have a bank of tissue, of blood, of brain tissue, the amount of information that we can glean from that will help us develop an understanding of what's causing this disease. And then ultimately that will lead to, again, treatment targets that we identify, and that will lead to new treatments and perhaps even a cure for this disorder. That's ultimately the solution for this problem. But we need to work together. We need to collaborate. We need to partner on this. And unfortunately, the American Registry for Migraine Research and the International Registry for Migraine Research was suspended about a year and a half ago because of funding. And so, again, it's a never-ending story. It's hard to do the research, and it's hard to continue to collect all of this data without the proper funding to be able to do that. But we're confident that, and we're working on new sources of funding to restart this registry, both domestically here in the United States as well as internationally around the world, because it's absolutely in the best interest of the field and, most importantly, in the best interest of patients.
Like, how can people help that are hearing this need and wanting to do something about it?
Well, that's a great question. I mean, obviously, they can go to the American Migraine Foundation and provide, their personal support. But beyond that, I think, some of our patients, for example, that are members of the American Migraine Foundation have held their own Facebook groups or fundraisers, if you will, Facebook fundraisers, just as an example, where they're able to raise a small amount of money. But you can imagine if there's, let's say, at least 40 million people in the United States with migraine, just in the United States. And if every one of them did their part, we would suddenly have all the money we needed to do this research. We would have this started in a heartbeat. We've got the infrastructure if we simply had the funding. And as you know, Carl, headache disorders in general are not well funded. If you look at the burden of disease, the prevalence and the burden of disease, headache disorders are in fact the least funded of all medical condition, given the enormous toll that it has on the number of people that are affected.
We had a lot of people from our community, including Jennifer and Alan, want to know, what do you do when you've tried everything you've heard of that could potentially help with new daily persistent headache, including devices, treatments, inpatient treatments, and basically has nothing in their toolbox? Do you go back to the beginning and start over? What's your approach?
When I hear a patient tell me that they've tried seemingly everything, we go through exactly what they have tried and how they've utilized it, because many times, even though they've tried many things, they may not have tried it at the right dose for the right period of time, perhaps even in the right combination with other therapies. So never lose hope, because chances are better than not that you've not tried everything. And there are therapies, Carl, that I utilize that sometimes are not only not used for new daily persistent headache, but not used for chronic migraine. So there are treatments out there that are safe, well tolerated, and can be effective in patients with chronic pain in general, of which new daily persistent headache can be thought of as kind of a chronic pain condition. So there are always treatment options out there. So I guess I would say never lose hope. And one treatment option that we're doing a lot of research on, Carl, just to give you an idea of that there's hope for the future, is we've identified there's a stress response that's been identified in the brain, and it appears to be particularly relevant for headache. And so when the brain is under stress, it releases a chemical called dynorphin. And dynorphin happens to be released from an area in the brain that's kind of a stress organ called the amygdala, and it binds to a receptor called the kappa opioid receptor. I don't want to get too technical on you here, but when you block that kappa opioid receptor in an animal, for instance, who might be under some stress, you block the pain response. There are kappa opioid receptor blockers currently in development that may be very useful as a preventive, not only for new daily persistent headache, but for many functional pain syndromes like migraine, like irritable bowel, like fibromyalgia. So there's an example of where understanding the anatomy, understanding the biology, understanding the chemicals involved, understanding the receptors allows you to identify targets, allows you to develop and synthesize new chemical entities and drugs, test them in animals, test them in humans, and ultimately develop new therapies. That's the future, and we're honing in on it, and I'm very optimistic, actually.
Dr. David Dodick, that's, I think, a fantastic place to wrap up. It sounds like there is some genuine reasons to be hopeful, and that the prognosis is not all negative, that there are options. Even if you feel like you've tried everything, there's still something on the table that can be used.
Carl, I don't think we've ever seen a patient with new daily persistent headache who we haven't been able to help. Not one. Do we cure them and do we rid them of their pain forever? No, not necessarily. But can we reduce their disability? Can we reduce their burden of illness? Can we improve their quality of life? Absolutely.
Dr. Dodick, where can people learn more about you and follow your work?
I have a Twitter handle at David Dodick, and I'm the immediate past chair of the American Migraine Foundation. So you can always reach me through and follow me through the American Migraine Foundation.
Well, Dr. Dodick, thank you so much for being such a wonderful advocate and clinician for people with new daily persistent headache. And thank you for joining us again on the Migraine World Summit.
My pleasure, Carl. Thanks so much.